Bacon. Love bacon. Hey?
On the Gold Coast at the home of Dr Alex Hines and Dr Gerardo Poli, partially blind and deaf border collie Diesel is facing a new health battle.
You can see when he stands, his head's tilted to the side.
Yeah.
Like as if the world is on an angle.
Good boy, Diesel. It's almost like when he starts to get really dizzy, he just wants to lay on the floor, doesn't he?
Yeah. Oh, you can see his eyes. His eyes are flicking bad now.
Yeah, I can see that now.
I've had Diesel for 13 years. I bought him as a companion for my first dog, Shiek, who I've had for 14 years until about 2 months ago. Diesel does miss Shiek. When Shiek passed, he became a lot sadder and a lot quieter. You know, I miss Shiek as well, and she was my first dog. And when I was in second year, I realised I didn't really understand the bond between humans and pets. And I bought Shiek as a way of actually understanding this bond. And I bought Diesel because Shiek needed a friend. Shiek and Diesel were my children, essentially.
But Diesel is suffering from more than heartache over Shiek's passing.
Diesel's showing neurological signs, which we call vestibular disease. They lose balance. And their eyes start flicking, they become nauseous. And Shiek developed that about 2 months ago, and she deteriorated rapidly and started seizing. And over just the last week, Diesel's actually been having multiple episodes of vestibular disease as well. Oh. As a veterinarian, I know that old dogs can get this, and sometimes it can go away and be okay. But he's had numerous episodes, and my big concern is that he has a brain tumour or something like that. Hey, poor matey.
It's really difficult for me to see Gerardo go through this. Generally, he's the strong one and he's there as my support. And now the tables are really turned and I need to be there for him. I hate seeing him in pain and know that I can be there for him, but I can't take that pain away. I think really you've got to find out what's going on, and the only way you're really going to do that is via the MRI.
Yeah, you're right. An MRI will give us more information.
I think that's what we've got to do.
I appreciate you being here, thanks.
Thank you.
Oh. I am clinging on to some hope that it is just inflammation that will pass. There's a possibility that he might just have a geriatric vestibular disease. If that's the case, it means that he just needs time.
Come for a ride, Diesel.
So today, I'm going to take Diesel into the hospital. Oh yeah, here we go. Good boy, mate. Good boy, good boy. And have an MRI to have a look at his brain and see if there is a structural change or if there is a mass there. Just a short little trip and we'll find out what's going on. Good boy, Diesel.
Does it feel a bit weird to bring your own dog in?
Yeah, it does actually. Oh, it's all right, Diesel.
All right, don't panic,
it's okay,
mate.
It's okay.
He really doesn't like being carried, hey?
No, he doesn't like me.
At the Animal Emergency Service on the Gold Coast, Alex and Gerardo have just arrived. Not for work this time, but with their own beloved dog, Diesel.
Good boy.
Good boy. Slowly, we'll get there. Yeah.
The 13-year-old border collie has been showing distressing neurological symptoms, and Gerardo is hoping an MRI will provide some answers.
If there's nothing there, then it will give me a sense of relief knowing that we could probably persist a bit longer with medical management and hopefully a bit more time, he'll get better. Almost there, mate. But I suppose I'm guarding myself and preparing myself for the worst. This could possibly be his last day. We'll find out what's going on in there, Hank, today. You don't like being in hospital, do you, mate?
He's a bit overwhelmed, I think, isn't he?
Yeah, he's a bit overwhelmed. I think the combination of him being in hospital here and also receiving unlimited pats from me today is making him feel a bit more stressed.
Yes, good boy.
Hey, bud.
Hi, how are you?
Dr. Peter Barron is the internal medicine specialist who'll be performing the MRI.
How you going, buddy?
Having a bit of a tough day today.
Oh, for sure. So, look, I think a brain MRI is going to be our best way of diagnosing his balance problems.
Yeah, his episodes, they're very frequent, and he gets better and then he gets worse and he gets better and he gets worse, and my biggest concern is that he's got like a tumour or something in there.
Look, it is a possibility in somebody of this age. You know, we're still hoping that he might have that old age vestibular syndrome where their balance centre just goes a little bit kooky for a while and then sort of comes back online, but fingers crossed, and hope we find good news for you with the MRI.
Yeah.
We'll take him through now and give him his pre-med and go from there.
You're a good boy, Hank.
Come on, buddy. Come on through. Gerardo hit the nail on the head when he said, I'm concerned because this has been multiple events over several days. And I think certainly with the geriatric syndrome, so this is where the balance centre sort of goes offline in older animals. You're a good boy, aren't you? It's idiopathic, which is just a fancy way of us saying we don't know why it happens as a veterinary community. And a lot of those cases will resolve. Here we go. They can have recurrent episodes. This many, this close within a certain period of time has me concerned. And that's why we're doing the MRI.
Oh, what a brave lad. It's a bit loud, mate, I'm sorry.
At the Animal Emergency Service on the Gold Coast, Nurse Michelle and vet intern Mel are preparing to anaesthetise Gerardo's 13-year-old Border Collie Diesel for an MRI.
Oh, your naked little arm. Yeah, my beautiful boy, you were so brave.
Good boy, Diesel.
Internal medicine specialist Dr. Peter Barron wants to find out what's causing Diesel's alarming balance issues.
Diesel's anaesthetic's going quite well, especially for an older boy. We're obviously very, very cautious with every anaesthetic, but I think when they're older, we're, on point with everything. So we'll proceed from here and see what we find.
Anaesthetic off, oxygen off.
1, 2, 3, you're right now.
With Diesel fully anaesthetised, Peter and his team can move him over to the MRI room for imaging.
Okay. Oxygen is on.
ISO's on 2%.
He is connected.
Across in their office, Alex is staying optimistic that Diesel will be okay.
Do you know how much longer it's going to take?
At least another hour or so. But when you're waiting, it seems a lot longer.
Yeah, it does.
I think G has already convinced himself that it's going to be bad news, almost because he needs to prepare for the worst. But I'm not so sure. I really think that there's a very good chance that the MRI could be clean.
Very happy with the positioning. Let's move out.
And Diesel may just need more time.
So basically what we've done is what they call a scout. So the machine does a quick survey of the brain in 3 different views. And so that way we can basically look at the brain in 3 dimensions. And those different settings, show us the anatomy of the brain, can show us inflammation, can show us clots within the brain like a stroke, aneurysms, burst blood vessels, those sorts of things. And of course the thing that we're hoping we don't find, which is a tumour. Diesel's out of the MRI now, and at this stage we're just going to wake him up out of his anaesthetic.
It's been a big morning. Poor sweet lad.
Peter knows that Gerardo is desperate to hear the results.
When you're dealing with someone's pet that you actually work with, it's very, very difficult having a chat with them about findings, especially if they're negative findings.
You're waking up?
On the Gold Coast, 13-year-old Border Collie Diesel has just undergone an MRI, and a nervous Alex and Gerardo are about to find out the results from specialist Peter Barron.
Hi, Gerardo.
There's a smile.
Yeah, there is a smile. No, it's good news. Yeah, no, really, really good news for you. So, yeah.
Ooh, it's good.
So this is his brain sitting in the middle here, and all of the balance centre is towards the back of the brain. And so we want to have a look at his ears down in here, and certainly his middle ears look okay. So when we have a look at this, there's no tumours, there's no stroke, there's no ruptured blood vessels. That all looks really nice and fine.
It's a huge relief actually to know that we've ruled a lot of those big things out that I'd be worried about, especially brain tumours. So,
yeah, at this stage, I think there's a really, really good chance that, he's got this idiopathic geriatric vestibular syndrome. We don't know what causes it, but the vast majority of dogs get better with it.
So maybe he just needs a bit more time?
Yeah, lots of TLC at home. He may have a recurrence of episodes, but, knowing that there's no structural lesion, no tumour in his brain or anything else like that, there's a good chance he'll get through. So.
Wow. Oh!
Yeah, great news. Really, really good news.
That's so good.
Thank you.
That's really good. Can you take him home? I was pretty sure that we'd be taking him home.
Oh, I wasn't. The MRI has given me an answer. Hey, matey. It's good to see you woke up okay. The plan of attack is take him home and continue to take care of him, making sure he's comfy and making sure he doesn't feel nauseous. Hey, I know you don't feel so good, but now we know that there's nothing bad going on in there. It's just a matter of time now until you get better, hey? And I suppose just treasuring the moments I have with him moving forward now. It's okay, good boy. Slowly, there we go. It was a real shock to the system and it really kind of brought me back to cherishing him and what he provides me. We might have to carry you, hey? Oh, I gotcha. Like a big baby. Get you home, get you comfy in bed. You've been a very brave boy today. I'm really impressed with how he's going.
On the Gold Coast, it's a special day for 13-year-old Diesel after he was diagnosed with geriatric vestibular disease.
Guess we're heading today. We're heading to the beach, Diesel.
Gerardo and Alex are treating Diesel to a special outing to his favourite place.
I can imagine the inner him is like, oh my God, the beach again. He loves the beach.
You just see in his eyes how much happier he is. Whoa! He just needs a bit of help.
Yeah, he's got a permanent kind of tilt to the side, but it's so much better than what he was.
Yeah, that's just how you see the world, isn't it now, Diesel?
Yeah.
Hey, it's just kind of this way up.
But he's doing all the things he needs to do. He's eating, he's no longer nauseous and sick.
He's doing so well.
Yeah. Well, much better than what I originally thought he would do, hey?
Yeah. Oh, yeah.
Diesel's recovery has actually been a lot less traumatic than I thought it would be. I was steeling myself for a deterioration, but he's actually just been really steady. He's eating, he's happy, he wants to walk around, so it's the best that I could hope for. And despite the fact he might stumble a little bit, there's no loss of happiness in his life there.
So good to be able to bring him out after all this time.
Yeah, he loves being out here today.
The beach is a big part of our life, and being able to bring him back down here to where he really feels the happiest was something we've been looking forward to for so long. He's just loving being out here. And really, sometimes you just got to stop and think, you know what? This time is precious that we get to spend with our animals. I think it's brought us all closer together.
Hi, I'm Dr. Danny Dusek from Bondi Vet. If you love our show and want to see more, plus some amazing content about pets and how to care for them, hit the subscribe button. Click that little notification bell and we'll see you on our next video.